Hi, and welcome to Community Hotline. My name is Monica Weitzel. We're here in Gresham at MetroEast Community Media. Glad you joined us tonight. We have a full show. We're going to start out talking with an organization called Project Access Now. And with me representing Project Access Now, we have Linda Nielsen, who is the Executive Director. Welcome.
Thank you.
And Jonathan Sauerwein, you are the Enrollment Assister Coordinator.
That's correct.
Okay. Thanks for being here. So Project Access Now, this was your brainchild, is that right?
I'd love to be able to take credit for it, but I was a part of a group of people that worked together, basically in healthcare at the time. So this was 8.5, 9 years ago. There were a lot of uninsured people, and there still are. And there still are. There's a lot less, though.
Yes.
And that's what we'll talk about. Jonathan's program is helping with. But essentially there were a lot of healthcare providers, physicians that were donating care in communities through different, we'd call them safety net clinics, so different clinics that are serving people who have Medicaid or maybe don't have any health insurance. But it was all kind of a mess, to be honest with you. And
not very well organized.
Not very well organized. Physicians were getting frustrated. People didn't have the support they needed. So there was a national model that we found called Project Access, and we decided we wanted to bring Project Access to the Tri-County area, and we did, and we called it Project Access Now. One of our thoughts all along was, when healthcare reform comes, we can go away. Because we, of course, thought, wouldn't that be great?
Yeah. And healthcare reform came.
Yeah. And we're still here.
Yeah.
And in some ways, I think we learned a lot through the first 6 years when we were working with different clinics, private clinics, safety net clinics, hospital systems. Obviously, people, we call them clients, not patients, because we don't provide medical care.
Oh, okay, that makes sense.
Really what we came to understand about the strength of our organization is that we are able to support a lot of different things, meaning that our goal is there's an individual human being that needs something.
Right.
And right now they have to kind of run a gauntlet to get
it's overwhelming.
the many things that they need. And so our organization is really committed to supporting and collaborating, creating networks, creating ways that people can get connected to the services they need in a way that's dignified, in a way that's efficient and effective. And
beautiful.
Yeah, so that's the big picture. So we still have, as you have mentioned, there still are uninsured people. So we do still have a classic program. We call it our donated care model. We take referrals for that program through different partner clinics.
Oh, okay. So as people show up, they are
so actually the best place for folks that have access to the internet, the coalitionclinics.org has a find a clinic function on it, and any of those clinics can, if there's a need to refer to Project Access Now, they do. Also 211 Info. If you call 211 Info, they'll refer you to a clinic. You're not going to get referred to Project Access Now.
But eventually.
Because the point is we aren't the front line, right? We support the front line in that particular program.
So tell me a little bit about how you support them. So you said you're connecting people with resources they need.
A person gets into let's say Wallace Medical Concern, which is out here, and Wallace Medical Concern is a great clinic. They're able to provide lots of services, but they don't have specialty care. So Wallace then refers to us when someone needs to see a cardiologist or a urologist or something, and so then we support them. We provide interpreters if they're not English speaking. We actually set the client up with an ID card, so they show up at their appointment and they look insured.
Right.
Which
just gives them some confidence,
Yeah.
I would think, just walking in the door.
Yeah, and again, the dignity factor is pretty
Yeah,
important.
yeah.
So we're still doing that. We're also, just real briefly, want to talk about another program that we are just starting to launch here in Rockwood, which is with about 20 or 22 different community-based organizations, and same kind of thing that, we know that all these agencies are serving the same families, or many of them are serving the same families. So we're creating a collaborative network, and we're going to basically identify families in need and assign that family a navigator.
Right.
Somebody who...
I was actually a part of a meeting here when
Yeah.
they were talking about
We
that.
must have met that day.
Yeah, that
must have been us.
Yeah, but
yeah.
and I wondered when you were coming on. So I said,
Yeah.
the same organization.
Yeah. So we're setting up the logistics right now, and then the pilot is going to launch in September. So
wow.
more to come. That'll be another show.
That's a lot.
Yeah.
That's a lot to do.
Yeah.
I mean, that's a lot
Yeah,
of resources
it is.
involved. Now,
Yeah.
you talked about the fact that there are a lot of people that are not enrolled in healthcare
Right.
of any kind. So, is that where you come in, Jonathan?
It is. We started a pilot project that involved the area hospitals, and the government's office, and one of the unions, the SEIU. And so they wanted to see if we could reach out and get 100 applicants.
1,000.
1,000 applicants.
Even 1,000.
Yeah.
That makes it even
That's a
better.
lot of
So
applicants.
1,000 applicants within a short period of time. And so, there was some doubt that we could by some, and then others thought that we would be able to. Well, we accomplished that by reaching out to the community partners in the various areas like Rockwood, Lentz, and throughout the tri-counties, and pulled in people that basically didn't know that they needed to have insurance just because of communications,
Right.
or had difficulty navigating the system. It's a very difficult system, whether you're going through the federal marketplace or the state-run OHP.
I think it's difficult if you have insurance and you've had the same insurance company forever. It can be very difficult to navigate the healthcare system.
True.
I can imagine being from another country and not having English as my primary language,
Right.
and trying to figure out the way we do things. It would be really overwhelming.
And the only way you can submit them electronically is in English. So we have a diverse group of people. We have Spanish speaker, Russian speaker, Vietnamese, Somali. Did I leave anybody out?
No, those are the languages.
Okay, those are the ones. And English. Yeah.
Well, they say now that there are 88 different languages spoken in this area, so
Oh,
you
yes.
better get busy. The rest of
Well,
them.
and it's amazing because we do have interpretive services that'll come out and work for us, but if you went through the application yourself, I dare the average person to get online and just fill out an OHP application without submitting it and try to understand the questions that they're asking and what you put there. So you take
Very
that
frustrating. I'm
with English as your second language, and it's been a difficult process for a lot of people.
I'm sure.
People are thrilled that we're doing this. In fact, we're out in 25 different locations throughout the Tri-County
Wow.
to every week, so that every
So
week.
you move around different. You're
Yeah, we're mobile.
So in the clinics, is that where you
We're
are?
in
Where
some
you-
of the clinics, and we're in a lot of the SNAP offices, WIC office, some specialty places such as El Español. Is that?
Programa Hispano.
Oh, that's the one. See?
through Catholic
I told you my
Charities?
Spanish
Yeah,
isn't great,
yeah.
but So we line up in some churches too. So
Okay.
we go to places where people are comfortable and they trust, because if you go, we also go door to door and we do flyering and stuff to drive people to these events.
Oh, okay.
But we found out that the best way is to be already involved with the community.
Right.
And then they'll go there and we help them there.
That's good thinking. So how is all this funded?
In a variety of ways. We receive some funding. One of the things that a lot of people don't know about the Portland metropolitan area is that every single hospital here is a nonprofit hospital. And what that means is that it's different. I mean, they're not a nonprofit like us. I just want to be clear.
The profit level is a little different.
But what they do is they take a certain amount of their revenue every year and they invest it back into the community through what they call community benefit.
Right.
And they support a lot of different initiatives, and our initiatives are some of those. And with healthcare transformation and these efforts, there's some state funding that could theoretically support things. There's a variety of of ways that we get money. Obviously, it's also, we rely on individual donors, just like everybody else
So
does.
if somebody really, has a little extra money and they want to support you, they can do that.
Yeah, or just to learn more about the information, more information about the organization. We really do have. I mean, we mentioned 3 specific projects, but we have other things, believe it or not, that we're doing too. But I want to go back to Jonathan's program too, because the first thing is to make sure people get connected to coverage if they qualify. So when Jonathan's out there, they can find people. If they qualify, they can enroll them. If they don't,
then we have other programs that we can put them towards. We can find out, like if they're CALM, so they're non-documented, we have the classic program that we can help them get medical care for chronic or emergency type situations where they may have to get a scan or an x-ray or something.
Right.
So they don't have to worry. We also have premium assistance, which allows us to pay their premiums if they're in a certain FPL, federal poverty level, which is 138 to 200. And then we work with another program with Kaiser that will go ahead and cover children that are non-documented, that are in school, which is an excellent thing. It's an amazing program. So.
Wow. Now, the services that are provided, volunteer doctors, volunteer...
for the donated care model,
Yeah,
it's all donated. I mean, it's written off. And again, hospitals can do that as a part of their community benefit. But I think what's most impressive about our classic model is that we've got about 1,000 individual healthcare providers in the community that aren't getting any benefit.
They feel good inside. They know
Yeah,
they know
that's
they did
it,
something
it's
good.
any
But that's
financial
really
benefit.
impressive.
It is. There's a lot of goodwill in this community, and sometimes a little bit of organization can go a long way.
So you're taking all those disorganized doctors and nurses and the people that are trying to get services and just kind of connecting them and
Well, they
guiding
want
them
it to
through
be
the
easy,
process.
right? I mean,
Yeah,
they're willing to donate more if it's not hard on them.
Well, that makes sense. Now, do you have a need for other volunteers that are non-medical personnel or?
Yeah, we do have some volunteers in our clinics. We don't have any clinics in our office. There are obviously, kind of clerical kinds of things.
Yeah.
Sometimes there are special projects. We have events. We have a marketing and development committee. Then we have a board of directors, and we have committees. And just like any nonprofit, we're always looking for real rich representation from the community that we're serving, and always interested in meeting people with skills or even just the desire to participate in supporting our organization.
Yeah, you work with the homeless community. Is
Yes.
that a pretty
Well,
good sized part of
yeah.
it?
We have we've hooked up with a couple of different organizations locally. We're at the food banks, we're at the homeless shelters, and everything.
So is that somewhere where you would sign people up?
Oh yes, yes, and then be
that
able
makes
to,
sense,
But, and the thing that we're looking for, and it's, even though our calendar is fairly filled with events that we do, we'd like to reach out to as many people as possible. So if there's an organization out there that's hiding in the woods, in a sense, that wants us to come out and help people get health insurance, they can contact us, and we would set something up. And it's amazing because not everybody's on the internet. As if you're looking for help, sometimes it's by word of mouth in these communities.
But those organizations that are a resource, those are ones that if they're not connected with you, but they have the clientele that would meet your mission.
Or and one of the different programs. I was going to say is different
It's-
programs serve different populations in different ways. But how many people are we going to enroll by the end of June?
By the end of June, let's see, what are we in right now? By the end of June, I'm hoping to have double our goal. The way we're going right now, I wouldn't see a problem.
So from 1,000 to 2,000?
Yeah.
Really?
Yeah.
That's pretty impressive.
It's picking up all the time. We had one person sign up 18 applicants last night.
Oh, wow.
So
that's impressive.
Yeah.
We're almost out of time. So what else do we need to know about your programs and about your organization?
I think if you look at our staff and everything, it's very diverse and it's a fun staff. They enjoy what they're doing. They're passionate. We would like, our name's getting out there. It's funny because at first, our name was good, and then now that we're out there more, it's amazing how people are going, calling us up and saying, can you come help us? So anytime we can get anybody who needs help, whether it be an organization or an individual, they can contact us. But in the same way, if there's people that want to help, the best way to help us is through donations and supporting us and being there at our events. We have an annual event fundraiser and stuff. We'd love it.
Okay, that sounds great. I mean, so support financially, support by telling other people about it.
Right.
And I think the other thing that is fundamental about one of our core values is, we don't do anything alone. There is
Right.
nothing that we do alone.
Right.
Everything we do is in partnership or in collaboration with many other organizations, and that's pretty exciting. It makes your work harder,
but it's worth it.
but it's
Right.
absolutely worth
Yeah.
it because it helps the families we're trying to serve more effectively, and it's really the most sustainable way to do the work we're doing.
Right.
And thank God that you're out there doing that, because I can't imagine having to do it without somebody to help me navigate that system. So thank you both for being on today and
Thanks.
for getting the word out about your organization. So
Thank
if you would like some more information, you can check out their website. We'll have you on another time and tell us about your fundraisers and different events they have. So there is help out there for you if you don't have insurance, so do check it out. And don't go away, we'll be right back with more of Community Hotline.
Coming here to shoot my documentary was more than I ever would have dreamed of doing.
This is a community media station.
It was phenomenal.
Ready, camera, one.
What is it about this place that makes so many different people come together?
Ready, camera, two.
Very professional, experienced people.
You can use these industry standard pieces of equipment.
Ready, camera, three. Take three.
You don't have to be rich to do this.
Open people's eyes to something they've never even thought of before.
Cool stuff happens. It becomes this community.
That's going to really change who's telling the stories and who's controlling the messaging.